Welcome to the Painwaves radio podcast by PainBC, the show where listeners can tune in and hear from leading experts on persistent pain as we discuss the very latest in pain management research, stories, tools, and trends. I'm your host, Geraldine Elliott, and before we begin today's episode, just wanted to run through a few things about PainBC for some first-time listeners. PainBC is a collaborative non-profit organization. We're made up of people in pain, healthcare providers, as well as leaders from various organizations, including other nonprofits, government, business, universities, etc. And we all share a passion for reducing the burden of pain while creating awareness of this unfortunately common problem. Living with chronic pain can be demoralizing, it can be debilitating, it can be isolating. Providing care for those in pain can also be confusing or frustrating. At PainBC, we aim to change this. We want to talk honestly about pain and remove the stigma. We feel like nobody should be alone with pain. If you want to find out more about us, you can go to our website at painbc.ca. Also, just please remember that the content we provide on the Painwaves podcast is for informational purposes only. It's not intended to be a substitute for any kind of professional medical advice, diagnosis, treatment, or care. We encourage everyone to seek the advice of qualified healthcare providers if you have any questions about the content of the podcast.
For the show, Maria, thanks for being with us today.
Nice to be with you.
So, can you start by just giving us a brief overview of what the Provincial Pain Summit is all about and why PainBC is hosting a summit?
Sure. So PainBC hosted the initial Pain Summit in July of 2011, and that really brought a whole bunch of stakeholders together to think about the lives of people living with chronic pain here in British Columbia and think about what needed to change to improve their lives, to support healthcare providers to care for them. And really the summit is building on that. So the summit is bringing people together, and when I say people, I mean people living with pain, clinicians who work with them, decision makers and policy makers from government, health authorities, and other organizations, and other people that are passionate about this topic. And it's bringing those people together to surface issues and identify solutions. We're holding the summit because so many of the things that we initially wanted to do in BC, many of them we've accomplished. There still are a number of sort of thornier, more difficult issues that we haven't been able to advance. So this summit is to relook at those difficult things, figure out, how can we get those things to change, and then to also explore emerging issues that we haven't yet tackled.
That sounds great. So you mentioned the first provincial summit. Can you tell us a bit more about what came out of that specifically and what that summit achieved?
Mm-hmm. Yeah, that summit was really the first time that people living with pain, clinicians working with people with pain, and various policymakers came together to talk in our province. Up until that point, pain really hadn't been so much on the agenda of people in the healthcare system. Of course, people who lived with persistent pain were struggling, but they had been sort of struggling silently. And that first summit really galvanized people. It brought people together. It was held at a time when PainBC was still a very young organization. And despite that, we had almost 250 people from across the province come together, dialogue with each other, and really identify significant gaps that existed. So those conversations were focused on a number of key areas, how to expand self-management support, how to help clinical people do what they're trying to do better, so how to support clinicians, the kinds of supports and services that people living with pain needed. Of course, we talked about opioids. We talked about how to expand services for people living with pain across the province. So there were a number of things that came out of that we've been working on with our partners since that time. So just to give a couple of examples, one of the big priorities that everyone identified was a training initiative for family doctors. So it was really felt that family doctors didn't have the training that they needed. They didn't have the supports they needed to adequately assess pain and help their patients manage it. So from that last summit, we went forward and we actually galvanized a lot of support and got the Doctors of BC, which is the new name for the BC Medical Association, got the Doctors of BC and the Ministry of Health to support a huge training initiative for family doctors. So that initiative is called the Practice Support Program for Pain Management, and that's now running across the province, where we've had several hundred family doctors go through that program, and it's actually spurred a number of them to go on and even do further training in assessing and managing pain. So that was one example. Another example was that many people told us that self-management support needed to be broadened. So self-management support are things that enable people living with chronic pain to manage their pain better and live better with their chronic condition. Many people talked about the self-management groups that run across the province. These are in-person groups. They happen over a 6-week period. They're led by peer leaders, and they're a great resource. But many people in pain and clinicians said, it's not enough. We need more options. We need online resources for chronic pain with a bit of a different model. So that was something that we were able to take and go, and with the support of the government of BC, we were able to build a new resource called Live Plan B that's now up and running, and it's being used by thousands of people. So that's another example of something quite concrete that came out of the last summit, and there are more examples than that.
So, it's definitely, as those examples show, the first summit very much based on, not just talk, but action. And that's the same kind of mandate for the second provincial summit. So, I know a lot of people might view a summit or a conference as just a lot of talking heads and, going and sitting and listening to experts. But because we want to focus on action and not just talk, can you tell our listeners a little bit more about exactly how that is going to work and what the format for the summit weekend is like, so that they can get a feeling for the model of the weekend?
Sure. So the last summit and this summit are really focused on bringing people together and to maximize the value of people being in the same room. It's not every day that we have leaders from the Ministry of Health, from Doctors of BC, from the college, from many other not-for-profit organizations, and clinicians and people in pain in the same room. So, we want to have them talking to each other, not just listening to somebody from the podium. So the summit is structured. The Friday night is intended to really ground us in the lived experience of people living with pain. So we will be having an expert panel of people who live with chronic pain, and they're going to be sharing their experience through a kind of interview format. And, we'll be taking some questions from people that are there in the audience, and then we'll be having some experts respond to the kinds of things that they raise. So not just telling their stories, but really exploring, what does this mean for changing policy in British Columbia? What does this mean for changing practice in the healthcare system? So we'll be exploring that together. On the Saturday, we'll be kicking off a bit of a recap around the 5 themes of the summit, and then we'll be moving into some interactive exercises. So we'll be having mapping the system exercise, where we look at the various aspects of the pain system in our province. So who are all those players and how are they interacting with each other, and what are some of the gaps and barriers? So we'll do that together, and then we'll move into the 5 breakout sessions. So just like the last summit, this summit is focused on 5 themes that we chose based on input from people living with pain, clinicians, discussions with government, etc. So this year, the 5 themes are primary health care, pain in rural and remote communities, pain in seniors, pain in vulnerable populations, and the last one being pharmacological pain management. So people will vote with their feet and choose which session they want to attend. And then they'll have some dedicated time to really talk together about what are the burning issues in this area and what are the potential solutions. So from there, that discussion will feed into Sunday, where we have a smaller group of leaders from across the system. So many of them are policymakers or people who have some decision-making authority in government or other institutions. Some of them will be patient experts who, bring forward their stories from the previous 2 days. Some of them will be clinical experts. They're there really to bring forward the evidence and their experience with practice. And they'll talk together about how do we move this forward into action? How do we ensure that this discussion doesn't stay in a report on the shelf and really quickly goes from this conversation at the summit into actual working groups, actual action that's carried forward by the people that are there. So, we expect people will be making some commitments to stay involved in the legacy of the summit, so the work that needs to come forward. And obviously, I'm sure there will be lots of to-dos for PainBC, but not PainBC alone. We expect a number of other organizations to be involved.
So the idea is really to identify, the issues, identify the solutions, and then identify who the players are that can take those forward. And so the Sunday is invitation only, that's correct?
Mm-hmm.
Okay.
That's right.
And the motivation behind that is to ensure that it's people that are in positions that can take it forward. Is that kind of the idea behind that?
Yeah, the idea behind that was that we really want to invite, the intention was not to be exclusive, but it really was to say to people in some positions of authority, don't just come to the summit and talk about the issues, come to the summit and commit to advancing the solutions with this diverse group of people. So we really wanted to have an opportunity for those decision makers to think, practically speaking, what is this going to mean? How do we move it forward? What are the resources that are going to be needed? Is there an existing group or committee or structure or policy that will advance that? And how do we get that to happen? So that was our intention.
And so obviously, you mentioned some of those stakeholders, and people in pain are really very central to the conversation. So in terms of, we've got the Friday night panel, there's going to be a lot of discussion with that. But in a broader sense, how are people in pain being accommodated and included in the summit?
Well, there are a number of ways. I think the first piece is that when we were determining the themes for the summit, we did a very broad consultation, both interviewing key informants, a number of whom were people living with pain. We did an online survey that close to 200 people participated in. Many of those people were people living with chronic pain. So really right from the get-go, we started shaping the summit around the input of those, the perspectives of people living with pain. Now, we have people living with pain attending the summit. For the thematic working groups, we have people in pain speaking as experts about their own lives on the panel. So we really want to put the lived experience of people in pain in the foreground. We know, and we heard this loud and clear at the last summit, that this level of participation, while it's really welcomed by people living with pain, it's also challenging. There's lots of sitting, there's lots of being in uncomfortable meeting room chairs. So we've been trying to ensure that we have a space for people who are in pain participating in the summit to go and decompress. So we do have what we're calling a comfort room. So that's a room that is just outside the main meeting rooms. There will be a variety of supplies there, so foam rollers, analgesic gel, hot packs, cold packs, comfortable chairs. We've been really grateful to Pain Pro registered massage therapy clinics who've come on board as a sponsor, and they will be providing complimentary body work by registered massage therapists who have backgrounds in working with chronic pain. So they'll be on site to support people who do need that. And we're hoping that will facilitate people who are living with pain to just be able to be more actively involved with the summit and not pay the price on the other side for contributing.
Definitely. And so there are, for each of those thematic sessions, there are facilitators that are going to be running the sessions, but there are also some co-hosts as well to those sessions. And then there are, as you've touched on, some different key players. Can you tell us a little bit more about who specifically is involved in that, or anything else you wanted to mention around kind of some of those key players and who they are, if you want to mention them?
Sure. Yeah. Well, we've invited representatives from all of the health authorities. We have representatives coming from the College of Physicians and Surgeons and from a number of other health professional groups. So the associations, representing nurses and occupational therapists, physios, et cetera. So we have many partnerships with those types of organizations, and they've been actively involved in much of the work we're doing. So we'll have a wide range of those types of actors who are involved in the healthcare system. There will be the Doctors of BC will be represented, the College of Physicians and Surgeons of BC, a number of other not-for-profit organizations that work with individuals that are the focus of the theme. So, for example, we have some seniors organizations that are coming, condition-specific groups whose constituencies deal with pain. So the Arthritis Society is another example where, they're coming out because they know that often people with arthritis have their condition well managed. Their arthritis is well managed, but the pain is not. So they really are invested in this issue. There are people living with pain and clinicians from all different disciplines. So physicians that work closely with people living with pain, nurses, social workers, mental health professionals, OTs, PTs, chiropractors, physios. We expect all of those folks, pharmacists, to be at the summit. So it really is going to be a very broad group.
So it's definitely pulling together, the whole spectrum of people that work with people in pain, but then also people in pain themselves. And I know there's some quite a lot actually of crossover there as well. There's a lot of healthcare professionals who live with pain themselves, and so it's bringing together a lot of those different groups, which is fantastic. So if anyone's listening and they're sort of not so sure, who do you think should attend?
Well, I think that if you are a person living with pain who is able to attend and wants to contribute to this conversation and be part of this next wave of making change, we definitely welcome you to come. The Friday night event is open to the public and complimentary. The Saturday session, there is a price for people who are representing organizations, and then there is a an inexpensive $20 ticket for people who are living with pain, and that's really just to offset some of the costs of putting on the summit. So we encourage people to attend if they're able. Clinical experts who have an interest with pain, obviously they're a key stakeholder here. If someone is listening and they work for an organization that intersects with this issue, we'd love for you to come and participate. And, obviously all of the government and health authority folks we've invited. So I think we're covered there. But really, we want people who see themselves as having a constructive role to play in moving this issue forward.
Definitely. And, we've talked a bit about what came out of the first summit. What are you really hoping the outcome of this second summit will be?
Well, I think that PainBC is still quite a young organization, and the last summit was held at a time when we were really just finding our sea legs, just getting established as an organization, trying to mobilize a diverse group of people and bring them together. And since that time, we've done quite a lot, and a lot of it's been organizing from the ground up. So working with people in local communities, working with groups of people in pain or groups of clinicians. And really what we're looking for now is a unifying pain strategy for the whole province. So we're really looking for everyone to come together and say, we will commit to some kind of common standard in all of the regions across our province. We'll commit to going beyond the practice support program that we have now for family doctors and some of our other clinical training to do much more intensive kind of mentoring and clinical consultation. We see so many people, they're maybe getting good care from their GP, but they need access to a specialist. And people are still waiting 2 to 3 years to see pain specialists in our province. So those are some of the sticky issues that we're hoping to address. The other thing that we know is that people living with pain many of them have really suffered under the new policy that was brought in last summer by the College of Physicians and Surgeons. So this is the policy that has, in effect, limited opioid prescribing in the province. And we support efforts to minimize the harms related to prescription medications. But, we've really seen people living with pain be weaned off their medication too quickly or denied their medication outright. So we're hoping that the summit will provide an opportunity to talk through those issues and come to more of a middle ground where the harms of medications are managed and people have access to adequate pharmacological pain management in our province. So it's there are going to be some challenging conversations at the summit, but I'm hopeful that it will move things in the right direction.
Definitely. And so before we close off, is there anything else you want our listeners to know about the summit and what to expect, or anything else you'd like to add?
No, I think I just encourage people to make their opinions known, and whether people can get there in public or in person, or be posting on our social media channels. If things are coming up, we will have some of our team members live tweeting. So those who follow us on Twitter can keep track of the conversation. But if people are not able to participate, there are other channels. Reach out to us through our website, reach out to us through social media, and share your perspectives. And of course, we'll be posting information, including a final report with a list of actions coming from the summit. So those who can't be there in person can certainly follow the progress.
Great. Thanks so much, Maria. I think that gives people a really good idea of the summit and what to expect. And so thank you so much for joining us and telling us all about it. We really appreciate it.
You're very welcome. Thanks for having me.
So if you're interested in attending the Provincial Pain Summit 2017, here are a few more details for you. As Maria mentioned, there are 2 ticket prices for the summit, but because of the structure of the summit, it can get a little confusing. So the Friday night, which is Friday the 17th of February, we have a panel discussion, and that is complimentary. We do need you to register for that so that we can keep track of numbers. Then, the Saturday, there are 2 ticket prices. There is an affordable rate for people living with pain of $20 to ensure that people in pain are able to attend. And then there is a $75 ticket for other organizations, healthcare providers, etc. So that is really a ticket for the Saturday, and that includes breakfast and lunch as well. Sunday, as Maria mentioned, is by invitation only. If you feel that you would like to be part of that conversation, then you can email info@painbc.ca. That's info@painbc.ca. If you want more details and you're also looking for the registration link, the best thing to do is to go to painbc.ca/summit. There's a lot of information on there. There's a registration link. There's a link to the full summit schedule so you can actually see the times, particularly on the Saturday if you're trying to plan out your day. And there's also more information on those 5 themes that Maria mentioned. So you'll see that the 5 themes are listed, and if you click on the link within each of those themes, it'll take you to a PDF with a lot more detail on the context, the problems that are faced within that particular topic or theme, and some of the key questions that we're going to address during those breakout sessions. We've also developed an app for the summit, so you can get the links to that through painbc.ca/summit, but there is a desktop version, which is really handy. There's also an iOS Apple version and an Android version. The great thing about downloading the app is that all the information is there. You can also register through the app, and you'll also be able to get any notifications during the summit as well about anything to do with logistics, like which room to go to for the summit. If you're unable to attend, and we understand that some people won't be able to make it because of the location or because, unfortunately, they're dealing with too much pain, you can follow the conversation and you can add your voice using the hashtag BC Pain Summit. That's hashtag BC Pain Summit. We'll be posting live tweets during the weekend. We will also be posting some live Facebook videos on our Facebook page, but we also really are going to encourage the participants and those of you following along outside of the summit to join the conversation and add your thoughts and opinions as well. So the best way to do that is to use that hashtag BC Pain Summit. So to register, to get more information, to look at the schedule, first step, go to painbc.ca/summit. That's painbc.ca/summit. Thanks so much for joining us on this special episode of Pain Waves Radio by PainBC. We look forward to seeing you at the summit in February.